Hello guys, Philly Kuts with a bit of an update on my manipulation under anesthesia for my right knee, which I got this past week on Tuesday. I believe it was July 30th. So I got the manipulation under anesthesia because I got knee replacement surgery on May 28th, and I have not been doing very well with the flexion. I've been getting to 105 prior to the MUA. That's with overpressure, and things have been going better for sure. Today is Saturday, so I have attended 2 PT sessions since my operation, and the plan is that I'm going to be going to PT every day, physical outpatient setting for the next 2 weeks. So every weekday for the next 2 weeks, 10 days, I'm going to be going to PT, and we're going to keep hammering on the flexion and extension. So first session went pretty well. I'm able to get to straightening 4 degrees, which is an improvement. I think before I was only getting to about 8, and I'm able to get to flexion now with overpressure to 115 degrees. And that's being measured with me doing the heel slides on the wall. There's a method of doing heel slides where you put your legs, you lay down on a bed, you put your legs on the wall, and you just kind of push your knee down and bend it as much as you can. So I'm feeling optimistic about that, and I have noticed some other improvements right away since my MUA. One thing for sure is I could definitely put my leg up on a chair way easier now. Before I had a lot of difficulty doing this. This was very stiff for me to do. This chair is a couple feet off the ground, but before I was having a really difficult time doing that. So that's been a definite improvement. And then the other thing, I would show you guys, but my girlfriend's in the bedroom right now doing her workout. On my exercise bike, I'm now able to keep my right foot straight, which is huge. So let me show you. Before, when I was pedaling, before the manipulation, I would have to kind of put my foot off to the side like this. I couldn't keep it straight and pedal like left. Or I had, because my exercise bike has stirrups that you put your feet into, I couldn't get my right leg into there like that. It just hurt too much. It was just way too painful. So now I'm able to keep my leg perfectly straight, my foot perfectly straight, and I'm able to pedal. And I'm up to 20 minutes. So prior to the manipulation, I was getting about 15. Now I'm doing 20 with keeping my leg and foot perfectly straight. And I feel like what that's doing is that it's giving my quad a much deeper stretch. So the one thing I'm noticing after this manipulation, you might be asking, like, where am I feeling most of the pain? And I would say most of the pain that I'm feeling right now is concentrated in my quads now, really. The knee doesn't necessarily hurt as much, but right now my inner quad hurts quite a bit, and also the outer quad. So I guess because, when they're manipulating and they're pushing your leg in to get the flexion, they're really doing a number on your quad muscles when they're doing that. So that's where I primarily feel most of the pain right now. But in a way, I'm kind of embracing that because while it does hurt, I feel it doesn't hurt as bad as if it were, in the actual knee. So some things that, other exercises that they're working on with me, mainly in PT, is a lot of stretching as well. I'm doing a lot of stuff where I'm putting my foot on like a box, and I'm just kind of leaning forward a lot to get a good stretch. And again, I feel that all mostly in my quad muscle. So I'm trying to really focus on the small victories that I'm seeing that I showed you, like being able to do the bike for much longer and keeping my foot straight while I'm doing the bike, and just being able to put my foot up on a chair a lot better. And I'm able, to get my socks on and off a lot easier right now. So just some little things that I'm trying to focus on to, stay positive and to keep motivated, That's one of the things that you have to do with this procedure is, with total knee replacement, is that sometimes the progress that you see can be pretty slow or stagnant, and you have to kind of celebrate those small victories when they come in order to keep yourself, motivated and help keep yourself in a positive light. So that's really what I've been focusing on. But so far, I'm feeling pretty optimistic. I'm not regretting getting this MUA yet. I feel like I'm moving now in the right direction again. And they're probably going to do another measurement for my flexion and extension on Monday when I go in. I think I go in at like 2 o'clock or something on Monday. I'll have to double check that. So I'll probably keep you guys posted on that, see how that goes. But on my own, I am trying to do 2 to 3 sessions of PT on my own, just to really keep the leg flexible. And I'm also just trying to stay on my feet more throughout the day, just staying upright, keeping busy, just to keep the leg, mobile and keep it moving. One strategy that I'm using too to help with my pain management and doing PT is that I'm making sure that I'm taking my anti-inflammatory, which is Celecoxib, I think. I can't say it. And I'm taking my oxycodone and my acetaminophen. I'm taking these about 30 to 45 minutes before I start a lengthy PT session, and I find that helps me tolerate better, the pain that comes with this. So I'm trying to time that the best that I can, use that to the best of my advantage, so it allows me to push through things even further. So the other thing that I'm noticing too is when I sit down, it's becoming a lot easier, as you can see, to just keep my leg bent back. Now again, like I said, most of the pain and strain that I'm feeling is not necessarily in the knee area per se, but it's really in these quad areas where I'm feeling, most of the pain and the stretch. So I'm hoping that I'm starting to turn a corner here. I'm feeling more optimistic, and I'm just going to keep plugging away with the PT as hard as I can. So keep hitting the PT, doing the exercises, and just concentrate on moving forward, and hopefully it's gonna work out, and I'm gonna keep you guys posted. I'll probably post some other videos too about maybe what my first couple weeks were like when I got the original knee replacement surgery. I have a whole bunch of things, tools and stuff that I still have that I used that were helpful for me while I was in recovery. Maybe show you guys how to set your shower up, stuff like that, stuff that you can use for your toilet. Because like I said, when you first get this thing done, the total knee replacement, you are nowhere near 100%, and ordinary things that you take for granted, just like going to the bathroom, sitting down, going to the bathroom, making yourself food. It's pretty challenging. So, all right, guys, thanks for watching, and I'll keep you posted. All right, peace.